Okay, so imagine, picture this. It's the 1940s. And mental illness, I mean, it's shrouded in mystery, right? Like total stigma. And the treatments, often brutal, not really working. And then comes this charismatic doctor. He promises this radical solution, a surgery, and get this, a surgery that can erase troubles of the mind. I mean,
That sounds crazy, right? Like science fiction. Well, that's the story we're diving into today, Dr. Walter Freeman, and the rise and fall of the lobotomy. You sent us this fascinating collection of stuff, articles, historical accounts, I mean, even personal notes. So today we're gonna go deep into his life, his methods, and the lasting impact of all of his work.
what's really striking about this whole story is how it connects with how we understand the brain. Like how that's evolved over time, and the ethical dilemmas. Right. I mean, what happens when a medical procedure just grabs the public, grabs their imagination, even if the science, isn't really there. Yeah, absolutely. And let's start with the man himself. Walter Freeman Jr., born in 1895, came from like this family. Medicine practically, I don't know, like woven into their DNA, right? Like
Yeah.
his grandfather, William Keene, total trailblazer, the first brain surgeon in the whole U.S.
Yeah.
I mean, talk about a legacy to live up to, right?
Yeah.
You can almost see how that shaped him. Like Freeman's ambitions. I mean, brilliant guy,
Yeah.
academically gifted, but driven. Like this need to make his mark, right? To find those solutions where everyone else they just failed. And his early struggles, like at Yale, and then his success in med school. It kind of hints at a complex personality, doesn't it? Like this mix of brilliance and maybe a bit of insecurity too.
Right.
Yeah, and he seemed drawn to the toughest puzzles.
Yeah.
And I mean, what could be more perplexing than the human mind, right?
Yeah.
Especially back then when mental illness was so poorly understood.
And that's exactly what pulled him to St. Elizabeth's Hospital in D.C., a psychiatric institution, right? And he saw firsthand the suffering, patients with schizophrenia, depression, I mean, anxiety. Imagine that, right? Like the desperation, the lack of any effective treatments back then.
Yeah, it must have been overwhelming. And while the world was, embracing Freud and psychoanalysis, Freeman, he was skeptical.
Yeah.
He believed that mental illness, it was rooted in the physical brain, not just the subconscious, right?
Yeah, he was a man of action, eager for real solutions, not these long drawn out therapy sessions. This desire, right? This desire for immediate results, this impatience, I think, that became, a defining thing for him. For better, for worse.
Yeah, for better or worse. That's a good way to put it. So he's at St. Elizabeth's, teaching at George Washington University. He's even on the district's mental health commission. I mean, the guy he's a whirlwind of activity. And it's during this time that he meets James Watts, this skilled neurosurgeon who shared his interest in what they called psychosurgery back then.
And this meeting, this would be huge, pivotal. I mean, both men, they were fascinated by the frontal lobes, right? This part of the brain that they thought controlled like behavior, personality.
Yeah.
They saw it as the key, right, to unlock the mysteries of mental illness.
And then comes Egas Moniz, this Portuguese neurologist. He was experimenting with a procedure called a leucotomy, severing connections in those frontal lobes. It was radical. I mean, totally unproven. But Freeman and Watts, they saw potential.
You have to remember, right? This was a time when options for treating mental illness, they were, I mean, extremely limited, and the idea of a surgical solution, however risky, it held a certain allure. And Moniz, he claimed some success, although his follow-up with patients was a bit questionable.
So in 1936, they took the plunge, performing the first lobotomy in the United States on a 63-year-old woman named Alice Hammond. She was suffering from severe anxiety and depression.
And Alice's case and the ones that came after, they showed both the allure and the danger of this new procedure. Right. Some patients they did experience relief, from their symptoms. Alice, for example, she became calmer, less agitated.
But there were side effects, often significant ones, right? Like memory loss, personality changes, even a kind of like emotional flatness. It was a trade-off, and one that Freeman, in his eagerness for results, he seemed willing to accept.
It's important to consider the mindset back then. Mental illness, it was viewed so differently
Yeah.
than it is today, right?
Yeah.
There was less emphasis on understanding the individual's experience, and more focus on controlling their behavior, on restoring order.
Right. Yeah. And that brings us to one of the most unsettling chapters in this whole story, the story of Rosemary Kennedy.
Rosemary's case, it's a tragic illustration
Yeah.
of how lobotomies were used, not just to treat mental illness, but to address what they saw as social problems or behavioral problems,
No.
especially within a family determined to maintain a certain image, right?
Yeah, Rosemary's story, it's heart-wrenching, Even amidst all the tragedy of these lobotomies, she was born into this prominent family, right? The
Oh,
Kennedys,
yeah.
ambitious, but from the start her life it was marked by challenges.
You're talking about the difficult birth, the nurse holding Rosemary's head, like in the birth canal, leading to like oxygen deprivation and developmental delays.
Yeah, it's a stark reminder, isn't it, of
Yeah.
how medical practices they've evolved so much, and how even well-intentioned actions they can have these unintended consequences. Rosemary, she faced an uphill battle right from the beginning, and it seems like her struggles they were met with a mix of love and frustration, especially by her father, Joe Kennedy Sr.,
Mm.
a powerful man, right, driven to succeed, and he expected the same from his children.
And it's crucial to remember the context. Back then, intellectual disabilities, they carried this heavy stigma. They often felt this pressure, right, to hide their loved ones, to keep up this facade of normalcy. And for a family like the Kennedys, with their political ambitions, Rosemary's differences, they pose this particular challenge.
So Joe Kennedy, he was determined to find a cure for Rosemary. He saw her as someone to be fixed, not accepted for who she was.
And that's where Freeman and Watts they enter the picture. They presented this seemingly simple solution, a surgery that could, in their words, calm Rosemary's her so-called outbursts, which we now understand were probably seizures.
And Rosemary's mother, Rose, she had reservations, right? She sent their daughter Kathleen to investigate the procedure. And Kathleen, she came back with a warning: don't do it. She had spoken to a journalist who'd witnessed the devastating effects of lobotomies firsthand.
But Joe Kennedy, known for his decisiveness, maybe his stubbornness too, he ignored the warnings. He went ahead with the surgery without even telling Rose or explaining to Rosemary what was about to happen.
It's hard to comprehend that level of control, especially when it involves such a radical and irreversible procedure.
The details of the surgery, they're truly unsettling. Rosemary was awake during the procedure, reciting poetry as Watts drilled into her skull and severed connections in her frontal lobes. They used her ability to speak as this crude gauge of how much brain tissue to remove.
It's almost unimaginable, and the outcome, as we know, was tragic. Rosemary was left with severe cognitive and physical impairments. She could no longer walk or speak properly. Her life as she knew it was over.
And the most heart-wrenching part is that Joe Kennedy, he never visited her again. He essentially erased her from the family narrative, right? A testament to the shame and stigma surrounding disability at the time.
Rose, on the other hand, she eventually learned of Rosemary's whereabouts and visited her. Imagine the guilt, the grief she must have. She must have carried all those years.
Rosemary's story, it raises these profound questions, doesn't it, about autonomy, about consent, particularly for individuals with disabilities. She was denied a voice, a choice in her own treatment. Her fate was decided by others with devastating consequences.
Yeah, it's a stark reminder of the dark side of medical ambition.
Yes.
Of how easily good intentions can be warped by ego and this thirst for recognition.
And sadly, Rosemary's tragedy, it did little to dampen Freeman's enthusiasm for lobotomies. If anything, it fueled his drive to refine the procedure, to make it faster, more efficient, more widely accessible.
Which leads us to his infamous ice pick lobotomy, the transorbital lobotomy. It's hard to believe that a procedure using a household tool could be considered this medical breakthrough.
It speaks to Freeman's growing obsession with speed and simplicity. He wanted to perform lobotomies anywhere, anytime, without needing operating rooms or these lengthy recovery periods. He envisioned this world where mental illness it could be cured with a quick in-office procedure.
It's almost as if he became blinded by his own convictions, right? Convinced that he was on this righteous mission to alleviate suffering. But in his pursuit of a cure, he seemed to lose sight of the potential harm, the irreversible damage he was inflicting.
His first patient for this improved technique was a 29-year-old woman named Sally Ellen Ionesco. She was struggling with depression, anxiety, and what they described as violent outbursts toward her daughter.
And in Ionesco's case, it's often cited as this success story with her daughter, claiming that the lobotomy it gave her mother back to her. But it's important to remember that these anecdotal accounts they don't tell the whole story.
Exactly. Freeman, he cherry-picked the positive outcomes while downplaying or ignoring the negative ones. He glossed over the findings of Amaro Fiamberti, the Italian psychiatrist who pioneered the transorbital approach, but abandoned it due to these concerning side effects.
One of Freeman's early patients, David Berman, he suffered a brain hemorrhage during the procedure because Freeman he punctured a blood vessel with the ice pick. Berman was left with seizures and partial paralysis. And what's shocking is that Freeman he described his recovery as fairly well.
That's a chilling example of Freeman's detachment, right?
Yeah.
His inability to fully grasp the gravity of the harm he was causing. He seemed to view complications as mere setbacks, not as evidence that his methods were inherently flawed.
It's like he was operating under this different set of ethical rules, driven by this belief that the potential benefits they outweigh the risks, no matter how severe.
And sadly, his partner James Watts, he couldn't rein him in. The story of Watts walking into their shared office and finding Freeman with ice picks like protruding from a patient's eye sockets, asking Watts to hold them for a photo op. It's almost too grotesque to believe. It marked the end of their collaboration.
By 1950, Watts had publicly denounced the lobotomy as a brain damaging operation and severed ties with Freeman. But Freeman, undeterred, he continued his lobotomy crusade, performing the procedure at this alarming rate, sometimes dozens per week.
He traveled the country in his van, which he nicknamed the Lobotomobile, bringing his miracle cure to the masses. It's a disturbing image, right? A man driving around performing brain surgery with an ice pick, almost like a traveling salesman hawking a dubious product.
It's hard to reconcile that image with the Hippocratic oath, right?
Yeah.
The vow to do no harm. Freeman's practices they became increasingly theatrical, almost carnivalesque. He was performing two-handed lobotomies, hammering ice picks into both eyes simultaneously, often in front of an audience.
And as if that wasn't disturbing enough, he even began performing lobotomies on children as young as 4. His rationale to prevent them from developing more and more severe mental illness later in life. It's a chilling example of how far he'd strayed from any semblance of ethical boundaries.
The case of 12-year-old Howard Dully is particularly horrifying. His stepmother, she sought a lobotomy for him because he was troublesome, exhibiting behaviors like daydreaming and leaving lights on.
It's a stark illustration of how lobotomies were used not just to treat mental illness, but to control behavior, to enforce conformity, to eliminate what they saw as undesirable traits.
And Dully's story is especially poignant because he survived. He lived to tell his tale, to grapple with the trauma inflicted upon him by a procedure that robbed him of his childhood and left him with lasting emotional scars.
It's a powerful testament to the resilience of the human spirit, but also a stark reminder of the lasting damage that Freeman's reckless practices left in their wake. You know, it's hard to really grasp like the sheer scale of Freeman's impact. I mean, over his career, he performed, get this, an estimated 3,500 lobotomies,
Mm.
and tragically, almost 500 of those patients they died from complications. You know, from the
Bucky.
procedure.
It's those numbers, they're staggering, and they only tell part of the story, right? Think about all the lives like indirectly affected, families, right? Grappling with the aftermath, individuals they're struggling with these lifelong disabilities, and society like wrestling with the ethical fallout of a procedure that was once hailed as a miracle cure.
Yeah, it's a stark reminder that medical progress, it isn't always a straight line. Sometimes what seems like this breakthrough can turn out to be this devastating misstep with consequences that ripple through generations.
Yeah, but here's the thing that really gets me.
Mhm.
Some of Freeman's patients, particularly those operated on by Watts,
Mm.
before their partnership dissolved, they did report improvements. They experienced relief from debilitating symptoms, and they were able to function better in their daily lives. So how do we reconcile that with the undeniable harm caused by lobotomies?
It's tempting, isn't it, to see those cases as validation, as proof that Freeman was onto something, but we can't ignore the vast number of patients who suffered severe and irreversible harm, and even for those who did experience some benefit, was it really worth the cost?
Right, the risk of personality changes, emotional blunting, loss of creativity, even death. These weren't just side effects, right? They were fundamental alterations to a person's very being. It raises the question: what does it even mean to be cured if the treatment leaves you a shadow of your former self?
Yeah, the lobotomy was in many ways this crude attempt to control behavior rather than to understand and address the underlying causes of mental illness, right?
Yeah.
It reflects a time when conformity was prized, and individuality, especially when it manifested as mental or emotional distress, was often seen as a threat.
And Freeman, with his unwavering belief in his methods, his need for speed and efficiency, he fit right into that mindset. He was a man of his time, but that doesn't excuse the damage he caused. Yeah.
Thankfully, the world has changed, right? Our understanding of the brain has evolved. We've developed these new, more nuanced approaches to mental health treatment that focus on therapy, on medication, and a holistic understanding of the individual. The era of the lobotomy has thankfully come to an end.
But Freeman's story, it continues to resonate. It forces us to confront these uncomfortable truths about the allure of quick fixes, the dangers of unchecked ambition, and the ethical responsibilities that come with wielding medical power.
It's a reminder that progress isn't just about innovation. It's about compassion. It's about empathy and a deep respect for the dignity of every human being. And it's about asking those tough questions. What are the potential costs of medical intervention? Who benefits, and who bears the burden?
These are questions we have to keep grappling with as we navigate this ever evolving landscape of science and medicine, because the pursuit of knowledge without ethics, without a deep understanding of the human cost, it can lead us down a very dangerous path.
And as we've seen with Dr. Freeman, that path can have these devastating and far-reaching consequences that ripple through generations.
So what does all this mean for you as you continue to explore the world? Consider this. How can we ensure that medical advancements they serve humanity, not the other way around? How can we advocate for those whose voices are often silenced? And how can we as individuals cultivate a sense of critical thinking and ethical awareness when faced with claims of miracle cures and quick fixes?
Yeah, the story of Dr. Freeman, it's a cautionary tale,
Right. Yeah.
but it's also a call to action. It's a reminder that we all have a role to play in shaping the future of medicine and in ensuring that it's a future where compassion and ethics they guide our pursuit of knowledge and healing.
Thanks for diving deep with us today. Until next time,
Well,
keep asking those tough questions and keep those minds sharp.